Welcome to another edition of MD Insight. My name's Conor Delaney. I chair our Digestive Disease and Surgery Institute, and I'm happy to be here today with Dr. Ajita Prabhu. Ajita is in our Department of General Surgery, but actually does a whole lot more than that. So, Ajita, first, welcome.
Thanks for having me.
Great to have you here. And maybe you tell us a little bit about what you do and tell the audience about some of the responsibilities you have.
Sure. So my first responsibility is as a surgeon, and I am a specialist in complex abdominal wall reconstruction. So I treat patients who have had abdominal catastrophes and need their abdominal wall reconstructed. The other hats that I wear include the Quality Institute Officer for DDSI. And so it is my job and responsibility to make sure that we're providing high quality care for all of our patients. And as we know, our surgeons do a great job, as do our gastroenterologists and all of that. So I'm pleased to be able to partner with you in that endeavor. Other things, I serve as an assistant program director for the general surgery residency program. And so I run the simulation for that department.
So your plate's pretty full. But let's go back to the start. So you do complex hernia, which is a specialty that I think many people know about, but probably aren't that familiar with, because I think a lot of the hernia work that's done is a little bit more routine than what you guys do. Maybe you talk a little bit about how you picked that field or evolved into that field.
Sure. I was fortunate to train at a place where my mentor, Dr. Todd Henneford, did a high volume of hernia repair and complex hernia repair. So there were patients who would come who had had prior operations and sometimes unfortunate and catastrophic outcomes. When patients get to the end of that type of situation, they often have gigantic abdominal wall defects that need to be repaired. And we're fortunate to be able to interact with those patients at a very vulnerable time. Many of them have had catastrophic complications, have had long ICU stays, and after that we're fortunate to be able to interact with them and often reconstruct their abdominal wall using mesh and biomaterials, and subsequently have great outcomes and return them to their great quality of life that they had before all these things happened to them. So over time, I've grown my practice in that area. I've had a great interest in mesh and biomaterials. And I've had the fortune to be able to even work with the FDA on some of the mesh clearances coming down the pike. So that's been a very special thing that I've been able to participate in.
So the other thing you mentioned is quality. And yes, it's been fantastic getting to work with you doing quality across the Institute. But I love the perspective you've brought as well, trying to bring the quality concept together with the Institute of Medicine goals. Maybe you tell us a little bit about your thoughts about the goals and how we integrate that.
That would be great. One of the things that I love about quality is that we have such an opportunity to touch our patients on every level, including not only providing the surgical care that we do, but also making sure that their hospitalization and the quality of care that we provide on every level is great. The Institute of Medicine has divided the domains of quality and healthcare into 6 different areas. And we are interested and committed to focusing on those areas for each of our specialties in GI and general surgery. So using that paradigm, what I'd like to do is look forward into the future with some prospective values set around each of those domains of quality and healthcare based on the Institute of Medicine paradigm. And what I'd like to see is, as we continue to surveil the current issues that we're looking at in quality in surgery and GI, including all of the normal things that we look at for hospitalization, we also want to grow our own value system based on that Institute of Medicine quality paradigm. So we have a real opportunity going into the future here, not only to do what has been done before, but also to grow that in a very prospective way, involving the physicians and involving their values and what matters to them in delivery of healthcare to the patients.
Yeah, I think it's critical, and I think it's a great perspective. So a lot of the quality side of things as well is complicated because there's such a compliance and reporting structure involved. So I think, as you know, a lot of physicians find that compliance and reporting side of things tough because it seems time-consuming, it seems unnecessary, it's not necessarily direct care of patients. What are your thoughts about it, and how do we keep people engaged in a tough space where we all, or none of us, have enough time?
I think the first thing is that when we are talking to physicians who are, as you mentioned, burdened and stressed, we have to bring ourselves back to why we came here to begin with, and that's the patient. So when we start to ask subject matter content experts what's important to them in the care of their patients, and we get their take on that, and then we include that into our paradigm, I think it really engages the physicians and care providers for the patients. So I think there's a little bit of a give and take. Some of it is stuff that we just have to do to take great care of our patients, but then the other part of it is really getting the opinions of the physicians who are taking care of the patients and incorporating that into our paradigm too. So I think we work together as a team, and as we all know, a rising tide raises all boats.
No, that's certainly true. That's certainly true. So another important opportunity, I think, for us with the DDSI, or Digestive Disease and Surgery Quality Program, is that we can look after caregivers, and we can look after caregiver safety and physician and surgeon safety. So what are your thoughts about some of the things we can do to try and improve safety for people around care? Because obviously we work with a lot of, in a way, dangerous equipment, and we use it every day, so we don't think of it like that, but it can cause harm to us as well as patients.
Absolutely. I think we have to take a very proactive stance, and we have to recognize that we are all in some amount of danger every day, simply by being in a procedural type of field. So importantly, I think not only do we need to maintain our awareness of our environments and be careful with the instrumentation that we're using, but here, as you know, we have a enterprise-wide initiative to switch towards blunt-tip suture needles, and also to really re-engage in eyewear and safety protection wear for all of our individuals who take care of patients on a day-to-day basis. So we really strongly encourage individuals to participate in our safe environment, and we encourage a culture of safety.
And I think you hit the key word there, is culture, and I think that may be something interesting for people to hear. Because I think we've really been able to get people on board. You know, initially you have people who are maybe a little bit cavalier, they've done it for years and never worn goggles or always used sharp needles. But I think you can change the culture, and people realize that, you know, you're keeping others safer, or you're keeping people who are more junior safer, who are closing fascia and maybe would stick themselves normally but use a blunt tip needle, something simple, and they don't. So
absolutely. And I think that culture of safety is what brings us all together too. When we do all of this together, it really kind of builds on the concept that we care about each other, we care about our patients, and we want to work in a safe environment together.
Absolutely. I think it's really exciting. Well, thank you for your time and discussion, and thanks for all you're doing for the Institute and for quality for us and for our patients. I really appreciate you being here.
Thanks for having me.